Welcome to another season of the ASTIT podcast, where we turn science into sense. In this season, we are introducing you, our listeners, to some of the Justice Community Opioid Innovation Network, or JCOIN, family. In episodes 1 and 10, you will hear from our funder, the National Institute on Drug Abuse. And in episodes 2 through 9, you will learn about cutting-edge and recent science published by some of the investigators working in the Learning to Advance Practice, or LEAP, program, a part of JCOIN. This is so exciting. So let's get started. I'm Danielle Rudes, your host, and this is ASTIT. Today we dive into a recent study published by Megan Novisky and colleagues titled Health Information Seeking Behaviors in Prison, Results from the US PIAAC Survey, published in the Journal of Correctional Health Care. This study examines how incarcerated adults access health information. In our day-to-day lives, living outside of a custodial setting, we may not think twice about how important this information is because it is so easily accessible. And we have so many information gathering avenues at our disposal. But in prisons, that is a different story. To better understand the health challenges faced by incarcerated adults, let's look at some of the broader statistics that were made available in June 2021 by the Bureau of Justice Statistics. Since this study is concerned with prison populations, that's what we'll look at too. About 43% of federally incarcerated individuals reported ever having a chronic condition, while 33% of federally incarcerated individuals reported currently having a chronic condition. This is compared to nearly half of the American general population reporting having at least one chronic illness. That's an estimated 133 million Americans suffering from at least one chronic illness. Nearly half of the American general population having at least one chronic illness is not so far off from the federally incarcerated individual population now, is it? An estimated 10% of federally incarcerated people reported ever having an infectious disease. 4% of the federally incarcerated people reported ever having hepatitis C, the most common infectious disease reported, and more than a quarter of federally incarcerated individuals, about 26%, reported ever having high blood pressure, the most chronic condition reported. That's a lot to take in, I know. Incarcerated individuals face substantial challenges in managing their health, and without the resources we all have in free society. So how they obtain their sources of health information is exactly what Novisky and colleagues wanted to study. These researchers used data from a nationally representative sample of incarcerated adults in the United States to look at what sources of health information incarcerated individuals rely on and how that reliance was associated with their self-rated health. Specifically, the study is based on data from the Program for International Assessment of Adult Competencies, PIAAC Survey, which included a nationally representative sample of 1,319 incarcerated adults. Surprisingly, healthcare professionals were not the most common source of health information for incarcerated people. Instead, incarcerated people reported relying more on television, social contacts, magazines, and books or brochures than they did on medical professionals. Isn't that interesting? Shouldn't healthcare professionals be the primary source of health information in these settings? After all, they are the most consistent avenue of information as they exist within every prison and are licensed and/or certified healthcare workers. In other words, healthcare professionals are the only guaranteed universal source of information incarcerated individuals have, since other sources can potentially be outdated, taken away, restricted, or not even provided to begin with, all depending on each prison. And yet, Novisky and colleagues found individuals housed in prisons did not rely much on these professionals for health-related information. Novisky and colleagues suggest that there might be barriers to accessing healthcare professionals in prisons. For example, limited staffing, co-payments for medical visits that many incarcerated individuals cannot afford, or even a lack of trust in the prison medical system could all play a role. If healthcare professionals weren't the most common source, what was? The findings here are broken down into two parts: primary sources of health information and the impact of health information sources. First, the study found that television and social contacts are the most common sources of health information for incarcerated adults, with between 60 to 71% reporting these as their primary sources. Second, the study showed that getting health information from magazines and books or brochures was associated with better self-rated health for incarcerated adults. This suggests that these print sources may be a particularly important pathway for improving health among this population. Unlike the non-incarcerated population, incarcerated individuals often lack unrestricted access to the internet and other digital technologies, which are primary health sources for many people outside of prison. This limited access to digital resources is a significant challenge faced by incarcerated individuals in accessing health information. Now, bringing it back full circle, the restriction of print materials is another challenge, as correctional facilities have great discretion in limiting access to reading materials, including health-related magazines and books and brochures. Additionally, many of the available materials in prison are donated and thus often outdated. And you know how fast medical information changes. The findings from this study, conducted by Novisky and colleagues, have significant implications for improving healthcare in correctional facilities, such as increasing the availability and diversity of up-to-date health-related print materials in prisons. This could positively impact incarcerated adults' health by providing them with comprehensive and reliable health information, since we already know this is a common way that they like to gather information. Another implication is the need to address barriers that prevent incarcerated people from accessing healthcare professionals, as this informational source should be more prevalent, but it's not as it currently stands. We must find ways to lower or eliminate in-custody healthcare copays, ensure adequate healthcare staffing in carceral institutions, and improve the trust between carceral residents and prison and jail healthcare providers. Healthcare is not a luxury. It is a necessity. Our prisons and jails are often filled with individuals with psychological and physical health challenges, both upon entry and some that develop during their incarceration. We, as a society, have an obligation to provide the necessary health services to the individuals housed in our federal, state, county, and/or city or local institutions, not just because it's the right thing to do for them, but because 95% of all incarcerated people will return to their families and communities. We want to send them home better than when they went in, for them, but also for the good of all of us. Thank you for listening to the ASTIT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Opioid Innovation Network, JCOIN, their Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters on this season, Sam Houston State University doctoral students Alexa Mata and Bryce Kushmerek-McCune. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their amazing production. Tune in again soon for another episode of ASTIT.